Well, now we're heading out to my colleague, Anjali Kamlani, who is joined by a special guest. Anjali.
That's right, Akiko. Thank you so much. We are joined now by the CEO of Quest Diagnostics, Steve Rusckowski, really a legendary individual in the healthcare space over the last 10 years at the helm of one of the most important healthcare companies. Steve, thank you so much for joining us here today.
Angela, thanks for having me.
I want to start off with, obviously, the pandemic, one of the most unprecedented situations that any CEO has had to contend with. You, of course, seeing that demand on testing like never before. Tell us about it and how you got through it.
Yeah, so it's been a busy 2.5 years, Anjali. It all started in the spring of 2020, when we first realized that this pandemic would be here and really sink its teeth into us. And so in March of 2020, we actually first started to bring up our testing, and then we brought it up, not just in one laboratory, but throughout our whole system of laboratories. And we thought it would be capped within the year, but it extended itself into 21, and we continue to have substantial testing this year as well. So fortunately for us, we've responded to what we needed to do from a testing perspective, and we're continuing to advance the science to provide serology testing and other ways for us to start to understand where people are in their protection for COVID going forward.
Yeah, I want to talk about that continuation. Do you feel like the company's at a place now where you can really continue to scale up and scale down as needed, considering the fact that we might be facing future pandemics?
Yes, we have now about 300,000 test capacity per day. We've been at a fraction of that for the last several weeks. We actually have seen the testing volume for what's referred to as PCR, the central lab testing capability for COVID, come down. But we're prepared in the event that it starts to ramp up, that we'll be able to bring on more tests. So we're not closing down that capacity, but we're prepared in the event that it comes back up.
Fair enough. Looking at the look back at the company, 10 years now at the helm, talk to me about what the industry's been through. I mean, it's been really a push into consumer-driven healthcare decisions. We're talking about, a virtual care really on the horizon. So talk to me about how you've seen those changes and where you see Quest's role in all of that.
Yeah, it's been a remarkable decade. If you think about it, we put in place the Affordable Care Act. We've had substantial cuts in how we get paid by Medicare in this industry. And then finally, as we just spoke, we just came through the pandemic. And so it's been 3 big changes within healthcare delivery. But through all that change, we've also seen emergence where when I joined 10 years ago, we said we're much more than a lab. What we do is empower better health with that insight we deliver every day for physicians and increasingly for consumers. And we also believe that the consumer is now playing a much bigger role in their healthcare. And so we brought up a capability a number of years ago to offer testing capability to consumers where they can go on and directly engage with Quest Diagnostics to get the test they need.
One of the other major milestones that the industry really went through was the Theranos saga. And everything that came after, the questions about testing, what do you think has been the biggest learning from that episode? And do you think that the industry is in a different place today?
Yeah, you think about what that dialogue brought to this industry. It was a dialogue around the importance of testing. The reality is we're about 2% of healthcare costs in this country, but we represent around 75% of the information that a clinician, a physician, a nurse, and an individual use to make that important next choice in healthcare. So very important portion of that information that's needed every day. And then secondly, what that period of time showed us is that we can test consumers in a much simpler, more convenient way. And at Quest Diagnostics, we actually have brought up our patient service centers, and we have around 2,200 of those. And many of those are now in retail-like settings. And we've actually started to partner with retail partners like Walmart, where we have some of our patient service centers in their actual stores. And so the convenience of getting access to testing and the ability for you to directly order it has been a new capability. All that came out of that dialogue around the importance of testing and the need for it to be much more available to consumers.
Another big issue in the healthcare industry today still is cost. I know that you've seen the conversation over the past several years. And I know right now the company is also doing something interesting when it comes to helping to balance out the cost of access to healthcare.
Yes, we have. Actually, a number of years ago, we said we need to do something about our healthcare costs for our employees. We self-insure about 60,000 people at Quest Diagnostics. So what we did is we put in place a different approach of managing our healthcare costs. We hired a physician with healthcare insurance background, and we started step by step, seeing what we could do ourselves to bend the cost curve. And fortunately, I'm pleased to tell you that we did bend the cost curve. And actually this year, what we just introduced in the fall, for 95% of our employees, there'll be no increase in their payment for their health care. For 5% of those employees, there will be a fee increase, and that's primarily for the highest paid people at Quest Diagnostics. So real good progress of bending the cost curve for our own employees.
And definitely a push into health equity. I've got to end with, just a look back and everything that you've achieved. And before Quest, also working at Philips. So you've really been in the healthcare industry for quite some time. What's next?
Well, I've got a long bucket list for my personal life. I've got 4 great grandchildren, 2 kids, and a lovely wife. And so we're going to spend more time personally. Well, professionally, I'll do something. I'm still thinking my way through that. I'm still actively managing Quest Diagnostics as a CEO. I'll stay as the executive chair till the end of March of 23, and then we'll enter the next chapter of my life.
Sounds good. Well, we'll have to leave it there, and hopefully this isn't the last we see of you. Quest Diagnostics CEO Steve Rusckowski, thank you again for joining us today.